Yeah, good morning, everybody. Like Irene and Sandy said, my name is Marianne Radley Wellhouse. I am the Public Affairs Regional Coordinator with Planned Parenthood of Wisconsin. So I'm one of the very few staff people that is here in the Fox Valley. Myself, Kobe, who some of you probably know, who was in my position prior, and Gretchen, who is our development or philanthropy officer. She is also up in Appleton, about 4 blocks away from me. So I do get to see some coworkers sometimes. It's been interesting starting a public affairs position during a pandemic. I have been with Planned Parenthood since June of 2020. So my position is remote. I work from home anyway, pandemic or not, but it's been hard not to be able to go out and about and see people. So I've been really trying to get on Zoom, meet as many people as I can. So thank you for the invitation today. I'm glad to be here. I'm going to start sharing my screen so that I can get into my presentation. And it looks like I need to flip a tab here. 1 second. There we go.
Are you able to share?
I am. I just need to figure out how I can do it. Hopefully I can do it in presentation mode, but I'm not sure if I can. If I can't, I'll just look at my slides. Okay. 1 second.
It should be. It's just that you have it. It's a little bit weird to navigate it when it is in presentation mode.
Okay.
Either way, we're good. Either way, we're an easy group.
Yeah. Thank you. I appreciate your patience for me right now while I try to figure this out. Share screen. There we go. That's what I want. Okay, so you can see my presentation there. I'm going to go into here. Okay, so you guys can see this, but can you see me?
Yes.
You can see me and you can see my presentation?
Yes.
Okay, perfect. Thank you. I can't see you. So if anyone has questions, it's a small group, so we can kind of have like a chat while I'm going through this, or we can wait till the end for discussion and questions. I'm really flexible. It's fine with me, however you all, want to run this, but I'm going to go through my presentation. It's going to look a little disjointed. I have the luxury of being able to pull together slides from different presentations my amazing coworkers have already put together. So this says Cedar and Marie on here. I am neither of them. So I'm going to just go right into my next slide and tell you a little bit about myself. So like I said, I've been with Planned Parenthood since June. And I was a volunteer with Planned Parenthood for many years before that. I actually know Kobe though from middle school, and he approached me about applying for this position last January of 2020. So before we knew any of this was going to go down, he had approached me. We had been in touch after he took the position at Planned Parenthood when I was a volunteer as well. So I live in Appleton. I work here at my house. I live with my husband and our daughter, who is just 18 months. And I have to tell you, this is probably my favorite age. She's super fun. And we have 3 cats. My hobbies during the pandemic have included exercising in my living room, hiking, and getting on the sourdough bread trend, and it's been going great. Also lots of cooking. And then when we live in more normal times, I do love to eat out at restaurants, which I will actually be doing later today, and traveling. My background here in the Fox Valley, though, is I have 11.5 years, about 12 years of experience in the sexual assault victim advocacy world. I worked at Reach Counseling in Neenah for about 12 years, both as volunteer and the advocacy program director down there until last year when I moved on to Planned Parenthood. So that's about me, about my background, about what I'm up to these days. So I'll just move right into the presentation then. The mission of Planned Parenthood of Wisconsin is to empower all individuals to manage their sexual and reproductive health through patient services, education, and advocacy. So those are our 3 main service areas that we operate under. I'm going to go over a lot of like what our services look like. I know that all of you on this call probably are pretty familiar with what we do, but there are some things I think that still surprise people, that people still aren't aware of, that we do provide in the community. So just, to be comprehensive and thorough, I'm going to go over some of that information as well as our history in Wisconsin. So our services include wellness and preventative care, reproductive health care, as well as labs and tests. And included in all of those service areas are preventative health exams, birth control prescriptions, gynecological exams, which include evaluation and treatment of infections, midlife services, early pregnancy complications, polyp removal, care in the postpartum period, and HPV education, screening, and vaccination. Under reproductive health care, the services that we provide are care during and after a miscarriage, abortion care, which is only offered at 3 of our 24 health centers currently. Surgical is in Madison and Milwaukee, and then Sheboygan does offer medication. Colposcopy, so follow-up after abnormal pap tests, limited male reproductive health services, as well as reproductive and sexual health care, education and information. And then for labs and tests, we do offer those life-saving cancer screenings, including pap tests, breast and testicular exams, pregnancy testing and options, education, HIV and STD education, testing and treatment, and endometrial biopsies. Now, one of our brand new services that I am very excited to talk about, and we're very excited to offer at Planned Parenthood now, is gender affirming hormone therapy. So this is a huge win for our trans and gender nonconforming community members. So this is reducing a lot of barriers for those who otherwise may have had to travel for hours, go out of state to receive this hormone therapy. So now folks are able to access this service at Planned Parenthood. We are currently only offering it at 2 pilot sites in person. So La Crosse and Eau Claire are our 2 pilot sites that are offering this service in person. However, gender affirming hormone therapy can be accessed from any of our health centers via telehealth. So if you know somebody in the Valley who might be interested in accessing the service or has expressed interest in it, or anything like that, someone locally here, encourage them to make an appointment at Planned Parenthood in Appleton or Oshkosh or Green Bay, because we can help them get connected with those services via telehealth. That's been a huge bonus, I would say, to the pandemic. I think a lot of different disciplines and professions have learned that, wow, a lot can be done virtually, and this really opens up access to a lot of services that we otherwise might not have been able to access. So education, medical assessments, hormonal medications, and referral resources are all included in that new gender affirming hormone therapy service. And then the comprehensive birth control methods we provide, I won't go over this in too much detail. There's a lot of different options, and we can provide any of these, whatever people are interested in, most comfortable with. And then the emergency contraception, of course, that has that asterisk that we just want to make sure everyone that we talk to about emergency contraception knows that it is not the same as the abortion pill. It is prevention only. It does not end a pregnancy. It just will not work if there's already an existing pregnancy. So the sooner the better if someone is worried about pregnancy after unprotected sex or a sexual assault, to access that emergency contraception. And then birth control by mail. So this is a really great program, again, with maybe people don't want to venture out during a pandemic. They can get their birth control by mail by registering for the quarterly contraceptive kit, which is very exciting. It includes birth control of their choice, condoms, and emergency contraception that will be sent through the mail to their home or wherever is safe for them to receive that. And then, accessing Planned Parenthood services. So we currently in the Valley, really all of our providers
Marianne?
mainly speak. Yeah.
Can I ask a quick question on the last slide, please?
Yeah.
So the last item there, emergency contraception, is that what they often refer to as Plan B?
Yes,
Okay.
it is. It's the same thing.
Thank you.
Yep.
Just
I
trying to make
believe-
sure I understand what all of
Yeah.
the vocabulary.
absolutely. I believe Plan B is maybe a brand name. And then
okay.
emergency contraception is just like the technical term of what that particular brand is. Yep.
All right. All right. Kimberly
Thank
Clark
you.
people, I heard that. I get it. It's not Kleenex. Okay.
So yeah, moving on, to accessing our services, language, we really, I think, only have providers currently speak English in our health centers in the Valley. However, we do access a language line. We want to make our services as accessible as possible. I know there's a priority being put on bilingual providers to make our services more accessible. All services are provided with the utmost confidentiality to protect the privacy of our patients. And we do treat minors, and those services are confidential as well, unless of course we suspect any type of abuse that would need to be reported. We accept insurance, well, I shouldn't say all forms, we accept many forms of insurance, but we also want to make sure our services are as affordable as possible. So we do work with people who might not be able to pay or who are uninsured, and we will never turn anybody away if they have an inability to pay for services. little bit of history about us. The first clinic opened in the US in 1916. First clinic in Milwaukee was 1935, and then Madison not until 1974. And again, those core services that we offer are healthcare, education, and advocacy. And then quick numbers here. This is statewide. So almost 60,000 patients served. These are from 2018. Nearly 350,000 services were provided. Nearly 13,000 folks were reached through our education and training programs, and then nearly 400,000 supporters across Wisconsin. And you all probably know, people that love Planned Parenthood really love Planned Parenthood. We have some of the best supporters, and I would say of a lot of organizations, Planned Parenthood supporters are very, very dedicated and amazing. So we are so grateful for that support. And then our demographic breakdown here. So as you can see, the majority of folks we serve are between that 20 and 44 age range, but we'll start later and see people beyond that. Race, probably matches the demographic of the Valley pretty accurately. And then poverty level. So 51% of our patients live at or below the poverty level. And again, that is just why it is so important to us to be able to remain accessible by providing services at low cost, no cost, so on and so forth. I'm going to switch my tab here too to show you a more local, this is our fact sheet for Appleton. So you all can see, you can see this, this fact sheet I'm showing you, right?
Yes, we can see it.
Okay, thank you. So you can see that, these are our statewide numbers, which is what I just went over, but these are our Appleton numbers. So if you all are interested in, well, what are the numbers in Appleton? Who's visiting us? How many services are they providing? This is what our Appleton Health Center numbers reported in 2018. So you can see just over 2,000 patient visits, or just over 2,000 patients served with just under 3,000 patient visits, over 2,300 birth control units, emergency contraception, 1,700. So, we're doing a lot of good work here in Appleton. And I just wanted to give you these numbers to show a more local picture of what we're doing here in Appleton. So leave that up for just a second. And if anybody would be interested in this document, I can share it. So like Sandy or Irene, I can email this to you after the presentation today, and you can feel free to share it with the group.
Thank you, Marianne. That'd be good. We do have a resource area on our website that we have for people to be able to go back to.
Great.
Marianne, I have another question.
Yeah.
So I'm noticing that you're saying that that Planned Parenthood is only offering abortion care in 3 locations statewide, and that there aren't any here in Appleton. So correct. If a pregnancy is determined to be, if the pregnancy test is determined to be positive, and that's what the patient is looking for, what do they do?
Yeah, so unfortunately that, if they were looking, and I have to be honest, I don't know who else would provide abortions if they're available in other clinics, other hospital settings. But if they were looking to receive an abortion at a Planned Parenthood health center, that would require them to travel to Milwaukee or Madison for that service. If it was early enough where they could access the medication abortion option, they would be able to travel to Sheboygan. And there's also laws in place, there's restrictions in place that require those waiting periods, right? So there's still barriers to work through. I don't know all of them off the top of my head, but I do know that they would have to travel down to Milwaukee or down to Madison, wherever they chose to access those services. There used to be a clinic in Appleton that provided abortion care. That one was closed down. Gosh, I don't even know, sometime within the last 10 years, almost 10 years ago. So that was a loss for the Fox Valley.
Do the people who picket there understand that those services aren't being offered in that facility?
Sorry, what was that?
The people who regularly picket that location on West Wisconsin,
yeah,
do they understand that those services aren't being provided?
I think they do. Yeah, I think they do. because I've recently visited our Green Bay and our Sheboygan health centers, and same, we don't provide, well, I'm sorry, Sheboygan does do the medication, but our Green Bay Health Center, there's protesters outside both locations. I believe Dewey is the name of the guy that is outside of our Wisconsin Ave clinic, and apparently he used to also be over at the Gillette Street one when it was open and when it was providing abortion care. So apparently he's just moved from there down to our Wisconsin Ave clinic. I really think with these protesters, it's more about just the name Planned Parenthood. I don't think it matters much to them that we don't actually provide abortion. Oh, wow, it's raining and my laundry is outside. Can you guys give me like 2 minutes? I'm sorry, 1 second.
Sure. Go ahead, Marianne. Go ahead.
We could pause. You were talking about the Dewey guy that was at the
Yeah.
clinic, but I think it's
Yeah.
kind of not really, I don't know how you would know what they know, that way. So, yeah, that's where you were in your presentation, and we stopped the
Yeah,
recording, but we can go
I'm-
back.
Yeah.
Sure, sure. Yeah, I think for a lot of folks, it's just about the Planned Parenthood name in general.
And was there more of your presentation that you were going to show?
Yeah, there is. I just wanted to come back on camera.
All
If we
right,
were having more of a
perfect.
chat because I can't see you when I'm presenting. So, all right, I will pull that back up though. Oops. Okay, there. So I was here, and now I'm going to move more into explaining the difference between Planned Parenthood of Wisconsin and Planned Parenthood advocates, and I'll move on to some of that more legislative stuff that we were looking to talk about today. So some of you may know that there's Planned Parenthood of Wisconsin, that is our health centers. There's also Planned Parenthood Advocates of Wisconsin, and they're two separate entities. Planned Parenthood Health Centers are a nonprofit, fall under the 501c3 I guess, chapter or identifier, and Planned Parenthood Advocates is a C4. So we are able to do electoral and political work. We, advocate on certain issues. We are able to endorse candidates and lobby around issues. So a lot of the work we do surrounding elections falls under this 501c4. And that's when you see the pink stuff, the pink swag, that is advocates. So the pink represents our advocacy arm of the organization. And, right now it's kind of nice because we are in a place where under current federal and state leadership, we're able to breathe a little easier. Nothing is really out there that is a major threat to reproductive health care. And we know that if something that did infringe on reproductive rights were to, move its way up, that we would likely see a veto of that by the president or by the governor. So, some of my coworkers that have been with Planned Parenthood for longer than I have, because I've not even been here a year yet, are just breathing sighs of relief right now because they've been with us for, the last 8 years, where there've been a lot of fights to fight in terms of preserving access to reproductive health in Wisconsin. And so right now things are looking okay. These are our priority issues, though, our identified priority issues that we work on at Planned Parenthood Advocates. And some of these won't be surprising. Some of them are, maybe a little bit, something more to think about how they relate to reproductive health care. But of course, reproductive health care is our main priority focus at Planned Parenthood, as well as expanding healthcare access. We also work on elections and voter access protections because we want to ensure that everyone has the right to safely cast their vote, to participate in local elections and federal elections, and environmental justice issues, LGBTQ rights. Being able to provide gender affirming hormone care is huge for us and our communities. Reproductive and social justice issues, as well as racial equity issues. So reproductive justice is a term separate from reproductive health care, and Planned Parenthood is not a reproductive justice organization. We are a reproductive health care organization. I'm going to go over the difference just in the next slide here. So reproductive justice is the human right to maintain personal bodily autonomy, have children or not have children, parent the children we have in safe and sustainable communities. So we certainly believe in all of those things, but reproductive justice was a term coined by 16 women of color led organizations in 1997. So we look to uplift the work of reproductive justice organizations, this one being Sister Song that coined reproductive justice initially. And since then, since the early 2000s, additional organizations have begun to form or reorganize themselves as reproductive justice organizations. So I love this graphic here on the left. It kind of goes through, reproductive justice is a very wide lens where when we're talking about reproductive health care, we're talking about things like access to birth control, access to abortion care, all of those types of things. Pretty narrow lens, just focusing on, health. Reproductive justice encompasses a lot of intersections and a lot of different issues, all incorporated into how that affects the family unit and how it affects our ability to parent or to not parent. So you can see things listed here: environmental, gender identity, building a family on your own terms, ending incarceration, supporting teen parents, all types of things. So I love that graphic. It's a quick Google image search to pull that up if anyone wants to look into it further, or I can send the slides as well. So birth control access, nothing really major has changed with access to birth control in Wisconsin. It is still only available through a doctor's prescription. There was some legislation that was attempted in 2019 that would allow pharmacists to prescribe hormonal contraceptive patches and pills to anyone 18 or over, but this didn't make it through the Senate. And then I already did talk a little bit about emergency contraception in the sense that it is not the same as medication abortion, but emergency contraception is available over the counter in every state. Most local pharmacies carry this. Planned Parenthood health centers also dispense emergency contraception, as well as Badger Care, but that does require a prescription. And then a little bit of overlap between my position now and my previous work at Reach Counseling as a victim advocate is Wisconsin Act 102 that does require emergency service providers to give sexual assault victims unbiased written and oral information about emergency contraception and dispense if requested. So I've been in emergency departments many times with survivors while nurses have explained, that this is an option available to them if they would like to pursue it. And oftentimes having to explain to them that if you're already pregnant, this won't work. It's just meant to prevent. And then sex education in Wisconsin. So this is all according to the Center for Disease Control and Prevention, and it's specific to Wisconsin fact sheets. I pulled this right off the CDC website. So local education agencies have the authority to choose or approve curriculum for sexual health education, HIV and STD prevention, and parents and guardians must also be provided the opportunity to opt out their children from this education. Instruction regarding contraception is not addressed, and abstinence is a required topic of instruction for sexual health. A little bit more information about the policies in Wisconsin. So in 2010, the governor at the time, which was Jim Doyle, the legislature had passed a law mandating comprehensive sex ed. 2 years later, former Governor Walker signed abstinence only into law in 2012. So current state law does not require sex education, and local school boards decide whether or not to teach sex ed and what is covered. So another reason why you all know local elections are super important. So, looking over these years made me think of something that I remember when this legislation was in the works, was being passed. And at the time, my husband was a high school teacher in Beloit. And I remember him telling me a story about how he had a 14-year-old freshman who was either pregnant or had already had a baby at the time. And I just couldn't wrap my head around how we're sitting here talking about having abstinence only sex ed when we know that there are pregnant 14-year-olds out there, and how this is not doing anything to help keep teens safe and help educate them on their bodies, on what their options are in terms of having sex and being protected from pregnancy and, sexual assault and all these types of things. So, just a story that came into my mind when I was putting this presentation together of some really real world implications of this type of work. So if sex ed is offered, abstinence must be covered. and stressed as the only completely effective protection against unplanned pregnancy and STIs, which we certainly know to be true. You know, abstinence is a valid option for everybody. However, we know we need to go beyond that when talking about sex. A little bit more required core topics. Talked about this a little bit. That's also required by Wisconsin law, is that the curriculum be delivered by trained instructors. Again, the parents would have the option to opt their kids out of the presentations, and has to be age appropriate and medically accurate, which is good. Not included is that the curriculum would follow national guidelines, or that instruction be sequential across grade levels. So this fact sheet, I just put the link right in there. It was just based off what the CDC reported out for Wisconsin. And then I wanted to put a little bit in here about what Planned Parenthood does in terms of sex ed. You know, we do have education programs and educators throughout the state that provide comprehensive sex education for communities, schools, and parents. That goes by the name Embody, which is our education program. They provide comprehensive sex ed training resources and information for a wide variety of audiences in Wisconsin, including individuals, for families, for parents who are like, how do I talk to my children about these things, for community groups, so on and so forth. And then on the right side here are some of the topics that are covered in those presentations. So then the budget, we're kind of in the middle of a lot with the budget right now. There was a session yesterday in which a lot of things were stripped from the budget, but a lot of things also made it forward. So I'm going to talk a little bit about what Planned Parenthood's budget priorities are and what we are advocating for in this current budget cycle. So the first one is a $30 million investment in the Healthy Mothers, Healthy Babies initiative. This initiative addresses racial health disparities in maternal and infant health outcomes. Because in Wisconsin, I think the disparity between Black mothers and white mothers is the greatest in the nation. Black mothers are 5 times as likely to die in childbirth than a white mother is. So we are, you know, I talked about reproductive justice, and this is one way that Planned Parenthood can use our clout, use our name, use our status. You know, we have a lot of resources behind us to help lift up this work that the Foundation for Black Women's Wellness is advocating for here in Wisconsin. So included in this $30 million investment is $3.5 million for grants to organizations working to reduce infant and maternal health disparities, $4.5 million to Black-led organizations working to achieve Black health and birth equity, and $1 million Medicaid investment for doula reimbursement, which is incredible. You know, I am a new mom myself, and thinking about how wonderful and beneficial the services of a doula would be is, you know, it's really great to see this listed in here, especially when you consider the disparities and the discrimination and the fear that Black mothers and families might face when receiving healthcare in a more mainstream setting. One of the other things that also made it through the first, this cut yesterday, or this review of the budget, is increasing postpartum Badger care eligibility from 90 days to 12 months to ensure that mothers continue to have access to the care they need after they give birth, which is amazing. Going from, you know, 90 days to 12 months is a huge, huge increase. Wonderful to be able to provide all of these important services to new moms for a full year. So then just a little bit more information. You know, I already said we are committed to health equity for all people. This Healthy Mothers, Healthy Babies initiative and the postpartum Medicaid coverage in the budget are just key starting points to ensure that women and families in Wisconsin are just given a better chance at a healthy life from the get-go. There's a lot to be desired when it comes to postpartum care, to maternity leave, things like that here in the US. So, you know, at least we can have like this little bit of a start here in Wisconsin. Some of the things that were stripped out from the budget, the Joint Finance Committee removed the Title V and Title X funding changes that would have made Planned Parenthood eligible for these funding streams again. So we will not be eligible for these funding sources this budget session. And I wanted to wrap up with a call to action. So regarding the budget, recently we ran a phone bank this week, calling folks to encourage them to call their legislators. So call your legislators, ask them to support the budget, ask them to support key pieces of the budget. I'm not sure what's next for the budget, but I know it won't be finalized till later this year. So I'm sure there's going to be plenty more sessions where it's being edited down. So get in touch with folks, the folks that represent you. I'm sure there's going to be more phone banking opportunities with this as well. And that's part of what I do. So if you're interested in that, please let me know. I can get you set up. Other ways that aren't so, calling your legislators or phone banking is join my email list. I have an email list. I send out a couple emails a month just to keep people informed on what's going on with us in the Fox Valley, making sure people know we're here. I also host monthly virtual currently drop-ins where just folks who want to talk to other Planned Parenthood supporters, they want to learn what's going on with Planned Parenthood, gather in a Zoom room on a Friday afternoon and we just chat. So those have been really well attended. We've had a couple local reps, Rep Snodgrass and Rep Shelton have both joined pretty consistently to, just chat with Planned Parenthood. So it's been nice to have that sort of engagement. Find us on social media. We're all over Facebook. We're on Instagram. We're on TikTok, which I'm not because I don't understand TikTok, but we're on a bunch of channels. And then I attend a conversational approach training. So this is a training that Planned Parenthood does, and my coworker Tia and a few others do great trainings on. And it's kind of based on how to have good conversations about controversial topics. So, it can be hard when people say, well, where do you work? And you say, I work at Planned Parenthood. And they were like, oh, okay. Because people get weird about talking about abortion and Planned Parenthood. So this training is really great. And it goes through finding common ground rather than trying to change minds. And it's just a really nice opportunity, both for Planned Parenthood staff and for anybody in the community who just wants to learn more about how to have these types of conversations. So those are available to anybody who's interested. She could do one for your group if you wanted. And then this is my contact information. I talked about the stuff over on the right-hand side. That's my email address. If you would like to take it down, send me an email if you want to be on my email list, and I'll add you to that list so you'll start to receive my updates. And that is all that I have for my presentation today. I'm happy to chat a little bit more or just stay on for what you all have to talk about.
Yep, Marianne, would you put your email in the chat as well, please?
Yep. I will. It's community, or it's the conversational approach. So I see the courageous conversations in here. It's not what it's called, but we've worked with a consulting psychologist to develop this approach, and meeting people where they're at. And it's really meant to not change minds. Going into a conversation wanting to change someone's mind is more difficult than it is to listen to understand, right? So if we're looking to change minds, we're probably not listening. We're probably just waiting for them to be done talking, and so that we can say our next thing. But this is really about finding common ground. So it's a really great, opportunity.
So I have a question. Seeing as how I only live a few blocks away from your location, I would like to get one of those yard signs and a couple of those little pink signs for my cars.
Oh, yeah.
Where can I get those at?
So we actually don't provide the yard signs. Those were made by a volunteer, and we didn't have any part of that, but I do have a ton of stickers and swag. Cindy, if you wanted to send me an email, I live pretty close to there too. I'd be happy to drop off a package of stuff for you.
Well, I can just stop in and pick it up too.
Okay, either way.
Yep.
Cindy,
Thanks.
you might look for John Fees on Facebook and see what he has. Do you know John Fees?
And
Lawrence,
he's
alumnus,
the pastor. Is he a pastor, I think?
former pastor. Yeah, Fease.
Could you spell it again or put it in the chat? F-E?
Yeah. Just hold on.
Okay.
So while I'm typing,
I was gonna say,
Marianne,
Oh,
so there was a statistic I had heard a while ago on the percentage of women who had used Planned Parenthood sometime in the past, sometime during their lives. And it was a huge
Yeah.
number, like 95%, something like that, which is, I can't help but think, that number should be tossed around more often, because that's why a lot of us women have such a strong affinity and support towards Planned Parenthood. You helped us when we were young, and typically it was when we were very young. So is that the number, like 95%?
I'm not familiar with the statistic off the top of my head. I know I think I've seen it around, but I couldn't tell you exactly what it is. I know it is high though. I'll look and see if I can find that.
Yeah, that would be great. Thanks.
Mhm.
Irene, I see that Barb joined us maybe after we did introductions. So Barb, would you want to introduce yourselves so Marianne knows who you are?
Sure. My name is Barb Luring. I live up in Green Bay, and I draw pictures that explain ideas. And so I do a lot of different things, but my heart is with Planned Parenthood and liberal type issues. And I like what I'm hearing here. And when you were talking about the women, that have used Planned Parenthood, that number is pretty high throughout our lives. It'd be great to have a series of ads that would have people that are willing to say that, and to say, I use Planned Parenthood, or Planned Parenthood helped me. And it doesn't have to be like, abortion is like a divisive thing sometimes, although it's necessary. And when people need it, they'll use it. But I think there are other ways that could be used, like in a personal kind of I think it would be pretty strong, especially if you had women of different ages and races, and but include us oldies too.
Yeah, you're right. And storytelling is a really big piece of talking about the work that we do.
Right.
Just including women's and everyone's personal stories about
And guys too, men.
Yeah, exactly.
Yeah.
Exactly. So talking about personal experiences is a huge way to talk about the services that we do. And I know that there are we collect stories, and I think a lot of times they're used at events, which we haven't had.
Yeah.
We'll have a speaker say, this is why Planned Parenthood is important to me. I've seen those in the past, but yeah, you're right. Absolutely crucial to explaining why Planned Parenthood should exist.
And an intergenerational one would be cool too,
Yeah, absolutely.
Perfect for social media, just little tidbits with a photo, almost does it for itself, almost creates itself.
Yeah. Just taking some notes.
So Marianne, I did have a question about, there was a statistic early in your presentation that was that 51% are below or at poverty level at the federal level for poverty, right? I think we have other information locally that we've shared based on what was it, a standard of living cost or whatever? What was that? It was like the United Way did it or something, but which was even a higher level to be at, right? So like the poverty level, you can't even do anything. And so we said that there's like a living wage kind of level that you would need to be in this area. So if that's higher, then that's telling me that there's probably more, is it 60, 75% of your patients fall under that level? So that's kind of a piece that would be interesting to know.
Yeah, that is a good point. And I'm just going to go see if that fact sheet I showed says anything about that. Well,
Yes.
Yeah, Sandy, what I do see on that fact sheet is it says of the patients we served in Appleton, 39% lived below the federal poverty level. Actually, I'm just going to share my screen so y'all can see this too.
Yeah.
I don't just have to read it. All right, so here, Planned Parenthood of Wisconsin in 2018, patients served, 39% lived below the federal poverty level, at least 77% were Medicaid eligible. So that is a little bit more local information about that.
Yeah, and Irene did put it in the chat that it was the Alice level that was in the United Way
Oh, yeah.
work, yeah, report, research.
Yeah. Okay.
I
Actually,
wasn't-
that
go ahead.
FPL statistic kind of makes sense because I used Planned Parenthood so long ago, I really don't hardly even remember it, but it had to have been when I was a student. You know, students don't earn really above the FPL, so that high percentage, 39% is a lot.
Mhm.
So it probably does, it skews towards younger, it skews towards students, I'm sure.
I wasn't aware of a waiting period that they had said for like abortion services.
Oh, yeah, I can look into more information on that. I know that that's been, I was pretty sure in Wisconsin we had that. Let me look into it and report back.
Okay,
I know they exist nationally.
yeah,
I thought Wisconsin did have one. Let me look into it and confirm or deny.
okay. Yeah, I know that that's been in the news lately, right?
Mhm.
When during COVID and as some of the emergency stuff was done for COVID, and then people had to have 2 visits, and
Yeah.
that's what I think you were getting at, is that if you have to go down to Madison or Milwaukee and there's this waiting period, that you're gonna have to stay there longer, or you're gonna have to come back.
Yep,
Okay,
exactly.
yeah, just, all right.
Just, no, thank you. I'll get more information on that, what Wisconsin has in place right now.
Yeah, I'm pretty sure we do have that. That was part of the whole ALEC agenda that's gone through every state.
Yeah. I just wasn't aware. I liked that several slides showed things that were relative to our legislative platform that I was a little surprised about. Like the paid leave, or what was it? Yeah, right? Was that what it was? Irene, did you catch that too?
12 months versus 3 months for Medicaid was one of them.
Yeah, that one was in there. I didn't know you were part of a reproductive justice kind of group, which is kind of amazing.
We're supporting the work of the Foundation for Black Women's Wellness
Yeah.
down in Madison. They're advocating for a lot of these, so we're putting our support behind those initiatives.
Awesome. Maybe it was paid family leave. I think, did you have a slide that said something about paid family leave?
Probably for one of our like priority issues. Let me see if I can.
Yeah, and
go
that's,
back.
a big part of what we've been watching. Irene's been working on that one for years.
Yeah.
That's how I know, the ED of Planned Parenthood Wisconsin, Mike Murray. He used to be the legislative or policy director is the right term for Wisconsin Alliance for Women's Health. And, so he testifies, he still gives statements and testifies at press events in Madison about paid family and medical leave. So last time I saw him was September of 2019 in Madison. He's very tall. He always stands out in the crowd.
Yeah, Mike's great.
Yeah.
Yeah.
So I would like to know, because you asked us to contact our legislators, that seemed like kind of a generic ask. What would be a more specific ask?
Well, in terms of, I guess, Planned Parenthood has a lot of opportunities, to get involved in different ways, because we know that people have different strengths and different skill sets, and not everyone wants to get on the phone. Certainly this past week, it was really important. We were asking a lot of people to contact their legislators to support these initiatives in the budget. So in that term, or, in that way, it was really, really a big ask for us. We're phone banking lots and lots of folks. But there's so many different ways to support the work that we want to do, whether it's locally at a health center, when we can get back volunteering again in the health centers, to support the work of the clinicians there, or if you want to take on more of a policy stance, then it would be more contacting your legislators to support certain pieces of initiative that help our patients. So it really kind of depends on what you want to do, I guess. We can
Well,
certainly talk
yeah,
about
so-
what's available.
So Marianne, this is the legislative committee, so they're used to being asked to contact their legislators.
Okay.
And then on your slide, you were actually fairly specific and then yet not in terms of contact your legislators to ask them to preserve certain items in the budget. And this would be in the governor's budget. So I guess the news yesterday was how much the Joint Finance Committee had stripped out of the governor's budget proposal. And so I know you covered it, but I'm still not totally clear what was kept in, like the support to increase postpartum support to 12 months. I read what you had. It sounded like it was kept in. Right?
Yes, it was. Yeah. So the Healthy Women, Healthy Babies initiative was kept in, as well as the Medicaid expansion, from 90 days to 12 months. Those are our two priority issues, the ones that we were advocating for, that were kept in. There's tons of other stuff, that was either eliminated or kept, but those are the ones that we were focusing on.
Okay. So is it too late to ask our legislators to
I don't think so.
No.
I don't think so. It's my understanding that there's going to be a lot of these sessions that are going to be looking through the language of the budget. So I think it still helps to, pick out what is important. These are our issues that are important. These are what we are going to be asking people to support moving forward. So if you want to do the same, it is helpful.
So
Okay,
once
so-
an item is out of the budget, is there a way to ask for it to come back in? I mean, is this a back and forth kind of thing? Cindy's shaking her head, yes.
Okay.
It is. It's going to go to Evers and then he's going to send it back and then it's going to come back. So yeah, there's still, this budget isn't finalized technically till the end of July. So there's lots of room for manipulations. So yeah, we can still ask for stuff to be brought back if you know specifically what it is you want to ask for.
Yeah.
Right. And so that I think is the gist of the question, Marianne, is what was stripped out in the area of reproductive health that we should be asking to be put
Brought
back in.
Yep.
So what we can do with like these call to action items, and if there's things that you want to research and get back to us, we can wait until we get your answers, Marianne, and then we put it out as a meeting notes, to the people that were here, to our committee, in case people want to take action that weren't able to join us. But we also have a blog that we can put it on.
Okay.
And then like your handout and the presentation, we can store on our website under our legislative resources. So people can go back and look at those statistics or, other topics that you had there. So I think that
Yeah, I will send you a few documents that you can either, put on your website if you want to, or just email it to the group.
Mhm.
And that'll give more information on our priorities and what we're advocating for in the budget. And I will ask about the things that we might like to see put back in.
right.
I know that when I mentioned the Title V and Title X, I don't know the ins and outs of those, of that funding, but I know that that's something that they did strip from allowing us to regain.
Mhm. Okay. If we get on
Excellent.
your mailing list, is that also like a rapid response kind of area? So like if there's a specific state bill going through and it's going to get its time on the floor or something, and you want people to then call the legislators at that moment specific about that bill, is that what your email would do too also?
That might come from the state list.
Okay.
So we have a bunch of regional lists, and then I believe all of the folks that are on those lists are also on our statewide mailing list that I don't send out to, but our digital organizer does. So this week, for example, she put out a quick, ask for folks to phone bank with us on Tuesday and Wednesday. And so it might be things like that, last minute opportunities, or let's, do this tomorrow. So I don't put out those like rapid response asks, but they might go out to the state list, which you'd be on.
Okay. So getting on your list would roll up to the other lists.
Mhm.
Okay.
And not much goes out from that list, so you're not going to be inundated with emails.
No. That's right.
Well, this has been
Yeah, I don't
super,
know.
Marianne. If there, are
Thank
there
you.
any other questions? Because I'm going to stop recording when we're done with questions. Yeah, yeah, okay.